I was just studying about the granular cell tumors. If you have never heard of this term, it's okay. It's not granular ossa cell tumor, it is granular cell tumor. Okay, if you didn't hear this word, it's okay. If you are an MBBS student, undergraduate student, then it's all fine because Robbins also mentioned in just one paragraph what is granular cell tumor, okay, in the central nervous system chapter. So don't worry, you just have to listen to this video. I'm not gonna explain in detail about the granular cell tumor. Rather, I'm gonna explain and concentrate on the normal anatomy of pituitary gland and hypothalamus, how they are connected, because it is very interesting. And to know the granular cell tumor, you have to understand the normal anatomy of how anterior and posterior pituitary are connected to the hypothalamus. Okay, so anterior pituitary is called as a adenohypophysis and posterior pituitary is called as a neurohypophysis. Why it is called as neurohypophysis is because it cannot secrete the hormones. Okay, anterior pituitary can secrete the hormones and posterior pituitary is connected to the hypothalamus directly from the axon, long axon coming to the neurohypophysis, that is posterior pituitary. Okay, posterior pituitary can only secrete the hormones like vasopressin and oxytocin. Okay, vasopressin is your ADH, antidiuretic hormone. Okay, now from the hypothalamus a long axon or long neuron come to the your posterior pituitary, which is a neurohypophysis, where the axons are just floating in the posterior pituitary. Suppose this is the posterior pituitary, your axons will be here, okay, terminals. They cannot float like this, okay, because these are very delicate ends, so it cannot float like this. That's why there are some supporting cells to these terminals. They are like tightly fitting to this terminal. Okay, they are holding this terminal. These cells, supporting cells, are called as a pituocytes. What are these pituocytes? These are if you are seeing in the microscope, these are like they are having the lysosomes, compactly packed lysosomes. Suppose hypophysis is releasing hormone and the terminal has this oxytocin or the vasopressin hormone. If the body needs the from the hypothalamus, the signal comes. If the body needs, these pituocytes will contract and open up these terminals. From these terminals, the vasopressin or any hormones will be released to the blood. Okay, suppose these are pituocytes and here is your blood vessels, and this end these are terminals. Okay, whenever the body needs, these pituocytes will contract and make a way for the terminal to release the hormones into the bloodstream. Whenever the body doesn't need the hormones, these are tightly packed to the terminal so that the terminal doesn't release any hormones. These granular cell tumors take origin from these pituocytes. So what happens is these pituocytes having a lots of lysosomes. Okay, in the granular cell tumor, these lysosomes are forming the granules, inadequate or inadequately functional granules, so that cellular debris is not digested by these enzymes. Since the cellular debris is not digested by these enzymes, there are lots of lysosomes start producing. So that's why when you see in the microscope, these are polygonal or round shaped cells with the inconspicuous nucleoli, and the cytoplasm looks pinkish because there is a cellular debris, and it looks granular because there is a lots of lysosomes produced. So that's why these cells look granular. That's why the name granular cell tumor. So that's how the granular cell tumor arise, and I cannot emphasize enough the normal anatomy that you have to know to understand the granular cell tumors. Okay, this is just the introduction for a granular cell tumor, and I hope you like this detailed video and how the anatomy links to the pathology. Thank you so much for watching, and I'll see you in the next such video.